We're live with my friend Emma Green, the tennis elbow queen. Really a pleasure and an honor to have her on all the way from the UK across the pond. And she's fantastic. She's been on the summit a few years now and just has a great background as a physical therapist and physiotherapist. Certified in clinical Pilates too, as well. So definitely a great varied background. And but yeah, as we mentioned, she's an expert on the elbow and just diagnosing and helping cure these ailments. So today we're here to talk about golfer's elbow and serve pain, and I'll be helping her demonstrate a couple of things too. So it'll be fun. But Emma, thanks so much for coming on to the summit. How are you doing?
I am great. Thank you so much, Miraban. This is great to be here again. I truly look forward to this every year. It is so fun to be here with you live. So thank you.
Oh, anytime. Yeah, thanks so much. It's really a pleasure. And I guess how it's interesting, that with the different, I guess, ailments or issues and niggles that we have as tennis players. So I guess how prevalent is golfer's elbow among tennis players? Because you had mentioned that was one aspect that you found was becoming more prevalent among your clients, right?
Yeah, it's obviously you think tennis elbow, and 50% of tennis players are going to suffer with tennis elbow at some point in their playing career. So obviously it's a big problem. It's hugely prevalent in the tennis population. When you kind of look at that compared to the general population, the research shows us between 1% and 3% of the general population will suffer with tennis elbow. So obviously it really does affect tennis players an awful lot when it's half of the population. Now, golfer's elbow in itself, and let me just explain this. So tennis elbow is on the outside of the elbow. Golfer's elbow is on the inside of the elbow. So they're essentially the same pathology. It's the same injury. They're just in different places. Both of them affect a tendon. I'm going to go into that in a little more detail as well as we kind of go through this presentation. But with regards to how many tennis players suffer with golfer's elbow, it definitely is a lower proportion. Again, going back to the general population, less than 1% of people are going to suffer with golfer's elbow at some point in their lives. It's about 10% of tennis players. So definitely less prevalent, but it is a problem. And it really affects people when they're working on their serve. And this is where I kind of wanted you to jump in, Miraban, to kind of help me with the biomechanics of this. So do you want to can you show us, I want you to just do and you can do this in sitting, just
Sure.
go through a serve motion, but kind of go through like super slow-mo so that we can see what the elbow is going to do. We're going to watch the right elbow, because obviously Miraban's throwing the ball up and then he's going to take the racket. He's going to bring the racket forwards. Look at that right elbow. Look at the stress that's going on the inside part of that right elbow. And this is where we tend to see these issues. You want to go through that again, Miraban, just so people can watch that right elbow again? That'd be great. So again, throwing the ball up, bringing the racket through as you really generate force, ready to impact. Look where that elbow is. Now, if we think about a baseball player pitching a ball, we think about lots of problems around the elbow with baseball players. And when they're pitching, if you see that elbow coming forwards like this, that's what happens to them. There's a lot of strain on that inside part of the elbow. And this is why tennis players can get golfer's elbow, because putting the strain on the inside part of that elbow, that's where they're going to feel it. That's great, Miraban. Thank you. Do you feel that on the inside of your elbow? You're just you're practicing your swing technique there. I love it.
Yeah, I am feeling, a little bit of something. So yeah, it's definitely stressful.
Talking about it, right?
Yeah.
On it. But yeah, it definitely that can put a lot of strain on the inside part of the elbow. And so if you are looking at practicing your serve, you're looking at changing your serve, you're looking at really working on that, trying to generate more force, trying to generate sort of a bigger impact. That is this issue that could potentially happen on the inside part of the elbow. So let's dive into what is golfer's elbow. And as I said, it's the same pathology as tennis elbow, just in a different place. So it affects the inside of the elbow rather than the outside. Golfer's elbow and tennis elbow affect tendons. Tendons basically attach muscles to bones. That's what they do. They're a connective tissue. And that is literally all they do. They connect the muscle to the bone so that when the muscle switches on, the bone moves. That's how the body works. What happens when you get tennis elbow or golfer's elbow is that tendon starts to degenerate. So let's go a little deeper into the anatomy of the tendon. If we did an imaging like an ultrasound scan or an MRI, and you look at a normal tendon, it looks like a rope. Imagine all the fibers very tightly packed together, very uniform, all in one direction. That's what a normal tendon should look like on imaging. When you get a problem like tennis elbow or golfer's elbow, imagine somebody's got hold of that rope and they've tried to unravel it. They're kind of twisting it the wrong way. The fibers separate apart, cells get in there that shouldn't be there. That's what a degeneration of a tendon is. And that's what happens in golfer's or tennis elbow. Now, that obviously, it causes a weakening of the tendon. So we get a weakening of the muscles also attached to that tendon. And it causes pain and discomfort because those fibers are not supposed to be apart like that. Is this making sense, Mirban?
Oh, yeah. Yeah, 100%.
Yeah, absolutely. So that happens. This is the number one cause of tennis elbow and golfer's elbow is overuse. So doing something repetitively over and over and over and over and over and over again. Think about if you're working on your serve, if you're working on changing the biomechanics, that can cause this type of issue because you're working on something over and over and over again. Now, adding a ball machine to this, and this is what I'm hearing from my clients. The force that has been generated through that, just the number of repetitions that they're doing, that's what starts to give them this type of issue. Now, the good part about tennis and golfer's elbow is they are both completely reversible. So yeah, it's not often we can say that word reversible when we talk about medicine and health, but this is reversible. So doing the right things at the right time can totally resolve this. Now, I'm going to talk you through these things. I'm going to go at a bit of a clip so that we can get through it, but don't worry, because at the end of the presentation, I am going to give you some resources that you can tap into that are going to cover everything that I'm talking about in much more detail. So make sure you stay till the end so that you don't miss out on those resources. All right. So when we're looking at golfer's elbow, how can we prevent it in the first place? Well, definitely looking at how many times you are doing something over and over and over again. It's really important to work with a coach when you're trying to change something, because it's all well and good you feeling the movements and you feeling, from your perspective, what you're doing. You want somebody experienced watching you doing those things. And obviously through the tennis summit this week, you've had access to some amazing coaches, but it's so important to get that outside perspective on somebody watching you, how you're doing something. Mm-hmm. They're most likely going to video you. They're most likely going to look at your biomechanics. They're going to analyze everything. They're going to see where that elbow is as you're going into your serve motion. That is so important. I can't stress that highly enough, because we don't want these things to develop in the first place. If we can prevent them, it's so much easier than having to treat them. So working with an experienced coach, somebody who you know and trust, who can take you through this and really help you to limit those biomechanical sort of anomalies that maybe could predispose you to this, that's really important. What if you are starting to feel it a little bit? If you've noticed something in the last few days, few weeks, maybe even up to about 3 months, you might be getting a little discomfort on the inside of the elbow. Now, obviously, I'm talking about golfer's elbow in this presentation. If you've got tennis elbow, all of these things apply. So the principles are exactly the same. If you're starting to feel it, you're going to ice it. You're going to ice it after you play. We want to bring down any inflammation, irritation that could be set up by what you're doing when you are practicing. So icing it when you first start feeling it is one of the best ways to really reduce that, bring it down. Now, maybe you're sitting there and you're kind of going, yeah, but Emma, I've had this for 6 months. This has been going on for a long time. Okay, once we get past the 3-month mark, it does become a little more complex. And it's because other things tend to be involved. Imagine dropping a pebble into a pond and ripples coming out over time. The longer the time, the further those ripples go. Now imagine the center where you drop that pebble is the elbow, the medial part of the elbow, the inside part of the elbow. Over time, it can start to affect things further down here. Over time, it can start to affect things further up here. And as that time goes on, more and more tissues can be involved. So you might need someone to look at your shoulder. You might need somebody to look at your wrist hand, maybe your thumb. You might need somebody to look at your neck. You might need somebody to look at how your shoulder blade is moving. You might need somebody to look at your mid-back. You know, we get this ripple effect, and it can affect other things over time. Now, that's not to say it can't be resolved. It absolutely can be. It's just going to take a little more, a little more intensity, a little more time, a little more sort of investment into doing the right things at the right time. Is this all good, Mehman? It's making sense?
Yeah, definitely. I mean, that's just showing you the power of like, getting to an expert like quickly versus letting it settle in and then just giving you more problems. And I was kind of making funny faces when you were saying that, kind of, I forget the word to say, but like cringing, basically thinking about like the more you wait, the more you get affected. So really important.
Yeah. It is. It's so true. And it is these things like tennis and golfer's elbow, because it's not like you had a big fall, or you really kind of like were running and ended up doing the splits and you're like, oh, pulled my hamstring. You don't get an injury like that generally. It can happen from a slip, fall, bump, bash, that type of thing, but generally it's overuse, so you don't notice it as it's kind of creeping along. When I work with my clients, the first thing I say to them, I say, okay, when did you start feeling it? And they'll give me a date. It's like, okay, maybe it was February. Okay, what happened 3 to 6 months before? What changed 3 to 6 months before you started feeling it? And then it might be, oh yeah, I went from playing twice a week to playing 4 times a week. It might be, I started changing my serve. I wanted to generate more power in my serve. So looking 3 to 6 months back from when you started feeling it and looking at what changed. Did you change your racket? Did you change your grip? What changed? Something changed to develop this. And it was ticking along without you even feeling it until boom, then you did feel it. And so looking at what the cause was so that we can change that, so that we can make alterations to take that abnormal stress and strain away from it. Now, if it literally was you went from playing twice a week to 4 times a week, you just went too fast too soon. Yes, we've got to resolve it back down. We've got to heal it back down, and then we just ramp you back up slower. That's okay. If it was a change in biomechanics, again, similar kind of thing. It might be, oh, maybe we need to just tweak things a little slower, change things a little slower. But again, that's where working with an experienced coach comes in, and they can really help you out with that. But if you have been feeling it for a longer period of time, you're still going to use the ice after you play, because it's always good to do that, but you're going to heat the heck out of it. Once something has been going on for longer than 3 months, it tends to be a little more stubborn. We tend to need to kickstart the healing process, and heat can be really good for that. It really gets the circulation going. So one of my favorite phrases is heat the heck out of it. And it literally means heat the heck out of it, and as much as you can. I used to say to people 2 or 3 times a day, that should be enough, get the heat on there. And then I had 2 clients completely independently of each other, heat way more than I told them to, and they both got better faster. So heat really does play a big part in tendon recovery. And the reason for that is going back to the anatomy of tendons. They don't have a good blood supply. It's just the way they're made. So muscles have lots of blood supply because they need that oxygen to come in to allow them to work and move. Tendons don't need that. They're just a connective tissue. They're just connecting the muscle onto the bone. So they don't have a good blood supply because all they're doing is connecting. Now, the problem with that is when you're trying to heal an injured tissue, the building blocks for healing come in the blood supply. They come in the circulation. So a tissue that doesn't have a good circulation is going to struggle to heal. And that's why tennis elbow, golfer's elbow, you could apply this to Achilles tendon problems, to patella tendon problems. Any tendon is going to really struggle to heal because of that lack of blood supply. So anything that we can do to increase circulation is going to help. Heat does that beautifully. So you're going to use a heating pad. The gold standard for this is 10 minutes out of every hour through the day that you can. Now, it's a lot. So I have some people who will literally, if they are sit in that computer all day, they'll wear wraps around their arm, like literally the whole time. They're just plugged in the whole time so that they're getting the heat in there the whole time. Now, there is no restriction on duration of heat. So what I mean by that is you can use heat as long as you want to. That is completely fine. There is, however, it can get too hot. So intensity, you got to watch that. You don't want to go too hot. You want it to be a nice, comfortable warmth. We want to be relaxing the tissues. We want to be getting the circulation going to the tendon. We want to be relaxing the muscles, but we certainly don't want to burn the skin. If you start affecting the skin, then you can't heat. You're going to slow your recovery down. That makes sense?
Yeah, definitely. So I guess if you don't mind, I'm a few follow-ups on my end, and we've got some good questions here in comments too. So
perfect.
One is, and I think you did mention like the heat wrap, but what are some of the best ways and easiest ways to heat yourself? Because I know, like, obviously, like sometimes in the shower, I'm just kind of like staying there a little bit too long and letting it run on my calf, which sometimes I've had some issues with, like a strain a while ago. But yeah, what sources of heat do you suggest, techniques for that?
Yeah, that's a great question. And there are so many different ones. So, I mean, the most obvious is a heat pad. And I actually like the ones that go in the microwave. They tend to have a little more weight to them, which can be helpful as well at relaxing muscle tension. And they tend to mold around the area a little better than the plug-in ones can. So a heat pad that goes in the microwave is great. I actually advise quite a big one that comes all the way around the neck and shoulders, because when somebody's had elbow pain for longer than 3 months, generally their neck is going to be involved. So we get this really big neck and shoulder heat pad that they can use, and then they can just slide it down over their arm as well. It covers that entire area. So a heat pad, absolutely you can use. If you don't have a microwave, you can absolutely use a plug-in one. That's completely fine. You know, use what works for you. Like I said, some of my clients use ones that literally wrap all the way around their arm. They can even, sometimes these can be like they can be USB powered, so they can have them on in the car, you know, like going to work, going from work, going to a game. They can wear the heat because they can just easily access it. A hot water bottle is completely fine. Like you said, standing in the shower, that definitely counts. The absolute gold standard is going to be a jacuzzi from here down. You know, that's going to be kind of nice. Yeah. If any of you want to say, Emma said I had to do this every day, completely fine. Go sit in the jacuzzi every day. That's okay. But also cardio exercise. Cardio exercise increases our circulation. It increases our body temperature. So that is very, very helpful when we're healing tendons. Now, obviously, it needs to be a cardio exercise that doesn't irritate the tendon. So for my elbow patients, they're not going to sit in a rowing machine. That's not going to be helpful. But they absolutely can run, walk, sit on a bike, you know, all of these things definitely count. Now, for you, Mebon, with your calf, like, or an Achilles, maybe you are going to sit on a rowing machine. Maybe you're going to do an arm bike. Maybe you're going to swim. Yeah. You know, there's so many options that you can utilize, but the beauty of cardio exercise as well is it gets the circulation going, which we know we need to do for the tendon, because we've got to boost that circulation to the tendon to allow it to heal. But we're also going to be releasing endorphins, your body's own natural painkillers. We're going to be releasing those happy hormones. You're going to feel a whole lot better. You know, there's nothing like feeling so depressed and down because you're injured and you can't do the thing that you want to do. We focus on all of the things that you can do. There's so much you can do. And cardio exercise is one of the best things to really boost that feeling, get those endorphins whizzing around, and you know you're a step closer to being healed.
Yeah, I love that. You never thought of cardio exercises as you know, heating the body, but obviously, you know, very great way to do it. And also, you made me think of my one of my tennis buddies. He actually had a calf issue as well, and he would go to his jacuzzi. He bought one for his house, which is awesome, and he would do that constantly, and even before matches. And then his calf, we stopped. The issue stopped. So, yeah, heat sounds like it's very effective. So great.
Yeah, it is. And it's kind of nice, you know? I mean, putting the ice on can sometimes be a bit, do I have to do this? You know, think about cold plunge and ice baths and all of that kind of thing as well. That's obviously very popular right now. And again, very, very helpful for general health and wellness. but it's much nicer to sit in the jacuzzi, isn't it?
Yeah, exactly. 100%. And as you said, I guess it sounds like, in the beginning, like ice is superior perhaps, but then like, longer term, the heat is the one that you need.
Yeah,
Yeah.
absolutely. And you can also interchange it. If you've played a hard match and you're feeling your elbow, you ice it when you get home. You're going to ice it for 3 days. Let's bring down any inflammation that may have been boosted by irritating it, by playing potentially. And then you can switch back to the heat. Now, if you are feeling your elbow and you're icing your elbow, you can still heat your neck and shoulders. You can still heat the forearm muscles, because a lot of the time the tendon gets irritated because the forearm muscles are tight. If we go back to your serve motion as you're kind of coming through, you're putting strain on that part of the elbow because of the position that you're in, but you're gripping the racket, you're holding onto that racket, and you are trying to generate as much force as you can coming through. You're switching these muscles on hard. We're generating a lot of force in these muscles. When we generate force in the muscles, it increases muscle tension. The muscles get tight. If that muscle is tight that's attached to the tendon, it's going to pull on that tendon. And it's just going to constantly tug and tug and tug on that tendon. And then that tendon can't heal. Again, we're back to that. So if the muscle tension is up and the muscles are tight, that tendon can't heal effectively. Heat is really good at reducing that down, bringing that muscle tension down, allowing it to relax.
Yeah, awesome, Emma. And one more follow-up for now, if you don't mind, is I guess what is the window for icing versus like, okay, you've cooled down for 4 hours now, it's not really like, maybe it's not as effective. Like, kind of what's your take on that?
Yeah, you definitely can. If you feel like you've irritated that elbow, if you feel like you've tweaked it, if you really felt it on a certain shot, ice for 3 days. So that's your window. Yeah, that's your window of opportunity. So it's completely fine if it's taking you 4 hours to get home or whatever. It's still going to work. It's still going to be effective for you within that 3-day window.
Oh, wonderful. Okay, perfect. Good stuff. Good stuff. Yeah. So, I mean, there's some comments and questions here. Do you want me to take some of those or let you go?
Yeah,
okay.
absolutely.
Okay, sure. Great. Awesome. So, hey, Mark. Mark's been on a ton of our live streams, so I appreciate that. And he says, can't wait to hear this info. I just battled with golfer's elbow for several months after overdoing it on my serve practice. There you go.
Yeah, you are in the right place, Mark. Wait till the end as well. You're gonna love what comes at the end.
Yeah, definitely wait till the end, for sure. John, I started following Emma's guidance for tennis elbow last fall, and it's been great ever since. Boom.
Yay! I love to hear that. Well done, John.
Yeah.
Woo!
Good job, John. Awesome. Mark, do the elbow braces help? Should I wear one while playing, even if my pain has resolved? If so, do you have one you recommend?
Oh, I love this question. This is so good. So, do elbow braces help? All right, I'm going to go back into the research. I love the research. I do geek out on it, I have to admit. Nice. And so what the research shows us is elbow braces can be effective within the first 3 months. Beyond that, they're not effective. Now, what I will say about elbow braces is, they can be effective in the first 3 months. The typical elbow brace that you see is the strap that goes around the forearm, and that can help both tennis elbow and golfer's elbow. The way that works is it goes on as tight as you can tolerate it without your hand going blue or tingling. And basically, you kind of put in the pressure around the muscle. It takes the pressure off the tendon. And that's why it feels better. Now, the downside to that is, well, there are a couple. The biggest downside is that when you put something external on the muscle like that, the muscle underneath switches off. And that's what helps the tendon. The muscle switches off, so the tendon feels better. When the muscle switches off, it starts to weaken. And that happens incredibly quickly. Within hours, the muscle starts to weaken. So if you are consistently wearing that brace, the muscle is going to weaken. You're not going to be able to rehab the tendon correctly because there are certain strengthening exercises we need to do to rehab the tendon, and you're weakening it, and we've got to try and strengthen it, and you're kind of taking yourself further and further and further down into weakening it. So you become essentially reliant on the brace. So that's the biggest problem, is it weakens the muscles. The other problem is if you don't just have a tendon issue. And so I'll explain that a little more. What I have found with see in the thousands of patients with elbow problems I've seen over the years is that once you get past that 3-month mark, most people have some kind of nerve issue that goes along with the tendon issue. They kind of go together like peanut butter and jelly, nerves and tendons. So once this tendon's irritated, the nerve kind of, we see that too. And in fact, the research does show us that 40% of people who are diagnosed with tennis elbow actually have a radial tunnel syndrome, which is a nerve problem. Presents very similarly, but when you put a brace like that strap on, it's impinging the nerve, it's going to make you worse. Wow. So if you've tried that strap and it's made you worse, you've got a nerve issue going on, probably as well as a tendon issue that needs addressing. So that type of brace can be helpful in the first 12 weeks. Ideally not, though. That is my goal, is for you to not have to wear a brace. Now, if somebody's moving house, if somebody has a job that has created their problem, it's like, okay, maybe we need to have this on for you when you're doing something that you know is going to irritate it. Short term, that's okay. Long term, no. The other types of braces that sometimes people use are, there's a wrist brace that kind of holds you in extension like this. This has been shown to be helpful for tennis elbow sufferers. Again, within the first sort of 6 to 8 weeks, very early stages. If you pass that, it's not going to make a lot of difference. Some people wear these at night because it makes them feel comfortable. They're sold as carpal tunnel braces. So you put it on at nighttime, it keeps your hand in that position because it's basically taking the tension off the muscles and the tendon. It's not going to make any difference to golfer's elbow, but that can help tennis elbow. And if it's comfortable for you at night, that's okay. They go on very loosely, so they don't have that same muscle weakening effect that the strap has. Some people like a compression sleeve. Just the kind of neoprene sleeve. Sometimes they have the copper in them, anything like that. Again, if it's comfortable for you, it's going to keep you warm. So again, kind of getting the heat in there, keeping the heat in there, that's okay. But as long as it's not too tight. If it's too tight, the muscles are going to start to switch off underneath. So ideally, we want you to be braceless. That's the goal.
Love it. Yeah, I think more natural is the best way here. Kimberly, I've been working on changing the biomechanics of my serve and working more. My pain is now in the forearm, not elbow. What's that?
Yeah, it's all related. So if we think about specifically tennis elbow affects the tendon on the outside. However, you can feel tennis elbow in different places. It can be right on the bone. It can be right on the tendon. It can be up behind the bone, kind of higher up on the humerus, on the upper arm bone. And very commonly, it's down in the forearm. And that's all tennis elbow. Similarly with golfer's elbow, you can feel it right on the bone. You can feel it right on the tendon. You can feel it in the forearm muscles. And it's still all golfer's elbow because it's those muscles that are attached to the tendon. You're feeling that tension in the muscle. You can reduce that with the heat. That heat is going to be really, really helpful for you right now, Kimberly. So try that.
Awesome. Thanks. Great question. Thanks, Emma. Let's see, maybe we'll take one more here. My buddy Arash, how's it going? Hi all, sounds like the best thing is to catch it as early as possible, but the tennis bug is strong, easier said than done. I had it for 2 months and really had to set my racket away. I gave it to my friend and never realized that I'd sneak back and take my racket occasionally, but only for some light hitting. Okay, not so bad.
Yeah, I know. It is a real challenge. And when I work with people, I always work with sports-specific elements as well. There's something that you can do. And so depending on the severity of the issue, I kind of take people through a 4-phase process. So phase 1 is all about, settling the symptoms down. Let's start building the foundation. We also start calming the nervous system down. This is something I'm going to go into in a second. But then phase 2, we're normalizing the soft tissues. We're bringing that muscle tension down. We're preparing the tissues to be able to tolerate what we need to do in phase 3, which is the strengthening that heals the tendon. So then we strengthen in phase 3. Phase 4, we get you back to doing everything you want to do. However, in phase 1, we're working on sport-specific visualization. Because again, the research shows us that doing sport-specific visualization keeps the neurons strong that do those particular moves. So in phase 1, we're doing visualization and getting really deep into the visualization of doing the serve, playing a forehand, playing a backhand, whatever it is, playing it perfectly. You're not moving. So you're not going to irritate the tendon or the injury in any way at all, but you're keeping the neural pathways strong that do those movements. Because the research shows us that the brain struggles to differentiate between reality and what's in our own head. And so if we immerse ourselves into visualization, imagining it in such great detail, you're going to feel the sun on your face. You're going to smell the grass. You can feel the ball in your hand. You feel the racket in your hand. Really immerse yourself into that moment that the brain sends those neural messages. It sends the messages down the nerves to the muscles to say, switch on, you're going to do this movement. Now you're not moving. You're not creating any force. You're not generating any issue in the tendon, but those neural pathways are staying strong. That's going to allow you to get back on court faster. And that's in phase 1. Phase 2, we start doing shadow swings. We start doing movements without holding on to anything. But we're going through those movements. We start super slow-mo, just like you did when you were demonstrating for me, Moban. And then we get faster. Phase 3, we're strengthening. We start to put a racket in your hand. You're not going to hit anything, but we're going to go through those shadow swings. Again, super slow-mo, building up the speed. And then we start to add in a wiffle ball, just a little air ball. Then we start to add in like a kid's ball, a light ball. And then we build up to the tennis ball. So throughout the rehab, there's something that you can do to be working on your game so that you literally can hit the ground running when you're able to.
Yeah, I really love this. And this kind of goes back to what you were saying, how, like maybe if you've increased your tennis from like 2 days a week, all of a sudden to 4 days a week, and then you get the pain. It's the same concept where it's really important to not just jump from like you had, elbow pain and now you're feeling like it might be good. And then you just go back to playing, a matches. You go through like the various like visualization and the light swings and so forth and then like a light ball. So I really like that.
yeah it's really important good.
Yeah, for sure. Well, Emma, we do have some more comments and questions, but I wanted to see if you wanted to continue and then we can go back to them or however you want to do it.
Yeah, I'm going to go through the stretch that you need to do for golfer's elbow now. So nice. Obviously, if you are feeling anything on the inside parts of the elbow, we've talked about the heat, we've talked about the ice and how you can use those things. We've talked a little bit about I call it relative rest. And so basically that is you can do anything you like that doesn't hurt. But if something hurts, it is irritating it. So maybe you need to hide your tennis racket for 2 months like people have done. But you can go through some of these other things. You can be doing visualization. You can work on shadow swings. You can slowly build up the speed and, kind of as I explained. So there are definitely things that you can do. However, that in itself is not going to heal the tendon. There are other things that you need to do to heal the tendon. We need to strengthen to heal the tendon. Again, the research shows us eccentric loading heals tendons. I'm going to come into this. However, you start trying to do eccentric loading too soon, it's just going to flare you up and you're going to be going, oh, I tried that, didn't work for me. Well, maybe you did the right thing at the wrong time. You got to prepare the tissues. Like I said, phase 2 works on preparing the tissues to be able to tolerate the loads that we're going to put through in phase 3 strengthening. So if you've not prepared the tissues, they're not going to be able to tolerate the things that you need to do to heal a tendon. One of the things that we use in phase 2 to prepare the tissues is stretching, because that's going to bring the muscle tension down as well. We've already talked about heat. That brings the muscle tension down. As we bring the muscle tension down, it's not going to tug on the tendon. That's going to then allow that tendon to heal. So in order to keep that muscle tension down, stretching is really important. Now, it's a super simple stretch. I'm going to teach you how to do that right now, but it's also something I would highly recommend you use as part of your warm-up. And it only needs to be a quick 10-second stretch when you're warming up. But when you're cooling down, you're going to hold it for 30 seconds. Because we know after you've played, you've generated force and tension in those muscles. We want to bring that muscle tension down. A quick 10-second stretch is not going to do that, but a 30-second hold will. So the stretch that you're going to do, and do it with me right now, you're going to put your arm out in front of you, palm to the ceiling. Then you're going to take your fingers down towards the floor. The other hand is going to pull that hand in. So if I show you from the side, you can see my kind of arm is out in front of me like that. We're pulling down. Now, don't just get on the fingers, get on the palm, because it's the wrist that we want to be pulling in here, not the fingers. Now, once you've got this position and you're feeling a nice stretch through the forearm, that looks great, Miban, you can then just bring the arm down in front of you. As you bring the arm down in front of you, you see that takes the tension off the shoulder. It allows your shoulder to relax down. This also takes tension off the nerves. And so we're stretching the muscle, but we're being kind to the nerves. We're being really kind to the shoulder. This is where you want to be doing that stretch. So this is where you're going to hold it for 30 seconds. Now, it's going to seem like a long time to start with. So set the timer on your phone or, check it on your watch. But a 30-second hold, that's been shown to be the sweet spot. Again, I'll always go back to the research. They've done a lot of research on stretching. We know that 10 seconds is a good warm-up stretch, but it's not going to decrease the muscle tension. 30 seconds is. If you hold it for 1, 2, 5 minutes, you don't get any more benefit. So you don't need to hold for long periods of time, but 30 seconds, you need that stretch.
Got it. Love that.
Yeah. So this is something super simple that if you do have golfer's elbow, you need to do this stretch. If you want to prevent golfer's elbow, you need to do this stretch. So if you start doing this now, if you don't have golfer's elbow, this is really going to allow you to avoid that. This is what we should be teaching all of our kiddos as they're coming up through tennis, teaching them these stretches. Now, just as a little bonus, we're going to go through the tennis elbow stretch too. That one is arm out in front of you, palm down to the floor. Then you're going to take your fingers down to the floor. You're going to do the same thing. You're going to pull the wrist in. So again, it's that same kind of position. It's just now the palm is down to the floor. Yeah, you got it. And then same thing. Bring the arm down, takes the tension off the shoulder, takes the tension off the nerves. You're going to hold it for 30 seconds. That is going to decrease the muscle tension in the forearm muscles on the other side. So 1 minute is going to bring that muscle tension down front and back in the forearm and basically help you to avoid tennis elbow or golfer's elbow.
Nice. Love that. And I don't know if I'm jumping ahead, but it made me think about the sometimes people grab weights and they do like these and then these. So I didn't know if those are exercises you would advocate for, if you're going to talk about later or anything.
Yeah, that's great. This comes on to healing golfer's elbow, because this is what you need to do. You need to load a tendon in order to heal a tendon. So again, this is what the research shows us. This research actually goes back about 25 years. And this research started on Achilles tendon problems, kind of going back to your calf, Mirban. And so back then, so it was like the late 90s, there was a group of scientists in Scandinavia, and they were looking at Achilles tendon problems, and specifically in runners. So they looked at a group of runners. They'd been through physical therapy. They'd tried, all the usual stuff. Nothing had worked for them. They weren't able to run, and they were actually waiting for Achilles tendon surgery. So they took 15 of these runners, and they put them through an eccentric loading program. Now, I don't know how they came up with the idea, but they did. They put them through the eccentric loading program. At the end of 12 weeks, none of those runners needed surgery. They were all back running. And they kind of looked at this and went, oh, this is interesting. And so they did it again. They did it with a bigger number. They did it with over 100, and they found similar results. So we know that eccentrically loading tendons helps to heal them. Now, the problem with tennis elbow and golfer's elbow, and like you said, Mirban, I'm just going to grab my little weight here. You see lots of these kind of wrist curls, and this is kind of very common exercises you see for tennis elbow and golfer's elbow.
Yeah.
The problem with it is that you're doing both concentric and eccentric. So let me explain what those are. So concentric muscle activity is when the muscle shortens. So when I lift my wrist up, the muscles of my forearm shorten to pick my wrist up. That's concentric action, pulls on the tendon. Eccentric loading is when I lower that weight down. This is going to lengthen through the muscle, it lengthens through the tendon. The tendon likes that eccentric loading. So when you're doing kind of just a up, down, it's making it worse, making it better, making it worse, making it better. Exactly.
Even.
That's it. And then you go, hey, why is this not working? That's the reason. So what we want to do is we want to eliminate the concentric portion. Now, the way that you do that is you use the other hand to lift up. And then you're going to lower it down. You use the other hand to lift up, and then you're going to lower it down. So you still get the eccentric loading, which the muscle really likes, but we're eliminating the concentric by getting the other hand to lift it up. Now you've got a question. Go and ask me.
Oh, I'm sorry to interrupt. Yeah, no, I was just going to comment. I remember one of my rehab exercises for my calf when I got a calf strain was to go up on your calves with 2 feet, so you have the support, but then you go down with the 1 foot. So it's like the same thing, right? They're focusing on eccentric.
Exactly.
Yeah.
And and if you want to take that even one step further, you go up on the good, down on the bad, up on the good, down on the bad, and just totally eliminate it.
Yeah. Great.
You got to be holding on though. You got to hold on to something to do that.
Yeah, usually like the rails or whatever.
That's it.
Yeah. Good stuff. Yeah.
So
sorry,
exactly the same concept. You got it.
Right. Perfect. Cool.
Yeah.
Nice.
So it's super important that when you're doing these, so to know that to heal the injury, to heal tennis elbow, golfer's elbow, you got to eccentrically load it. You've got to be in a good position doing this. And I'm really picky about how people set themselves up doing this, because if you're not in a good position, it's really easy to irritate things. And I've done this to people. This is all I'm talking from experience. I have done this to people for sure. So I used to teach that exact exercise with somebody sitting with their arm, like if you're sitting in a chair with arms, you're kind of leaning on the arm of the chair. So they're resting their arm on the arm of the chair. They kind of lift up and they lower down. They lift up and they lower down. And I was like, this is good. You might even see it if you Google exercises. People will sometimes lean forwards with their arm on their thigh, lift up, lower down, lift up, lower down. Now, in the early stages, when you're using weenie weights like this, you get away with that. It's fine. Okay. However, if you're playing tennis, as you all are, you need to build up to 12 pounds with these exercises. I'm going to say that again, 12 pounds. It's heavy. It's heavy because if you don't, and this is one of the biggest things I find, sometimes people will reach out to me. A lot of tennis players will reach out and say, I've rehabbed my elbow, but I just can't get back on court. I feel fine at work. I feel fine doing everything around the house, but I just cannot play because every time I hit a ball, it hurts. And I'll ask them what they did, and they've done a lot of the right things. And I'll say, how much weight are you using for your eccentrics? And they'll say 3 pounds. I'll be like, that's the reason. You're just not heavy enough. That's literally all it is. In order to be able to tolerate hitting a ball the way you guys want to hit a ball, you need to be at 12 pounds plus. So being light is not going to cut it. Now, let me go back to the person that I had on with the arm of the chair. I don't know. Can you see how my spine is bent to the side when I'm like this? Or leaning your arm on your thigh, how your spine is bent when you're doing that? I've had people come back to me saying, my elbow feels great, but my back is killing me. I'm like, oh, that's not good. So you've really got to look at the position that you're in when you're doing these exercises. It is crucial to be in a good position. We don't want to then have to rehab your back, so being in a position where you are resting your arm on a desk or table so that the weight is in line with your body. Ideally, you want the weight to be as close to your belly button as possible. Belly button is our center of gravity. So if we can have the weight close to our belly button, so think about if you're sitting at a desk or you're sitting at a table or you're maybe standing at a countertop, if that arm is resting and that weight is next to your belly button, I'm going to stand up so that you're in this position. So that weight is as close to your belly button as possible. My spine is straight, right? So nothing here is going to twist me or be a problem to my spine. So that's the position you want to set up when you're using the weenie weights, so that as you progressively and slowly get heavy, because we go I mean, I'll start some people even unweighted. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, maybe 15, maybe 20, depending on your symptoms. But we're going to progressively build up. That's the goal. But you've got to be in that good position, because if you are in an awkward position for your spine and you're trying to use 12 to 15 pound dumbbells, you're going to be coming seeing me with your back. That's for sure.
Yeah, no, 100%. I just want to be mindful of time. I mean, we still have time, obviously, but we've got like 2 more back to back. So, do you want me to let you keep going, Emma? I just want to double check if there's other stuff you wanted to cover, and then we have like some questions, obviously.
Yeah, I just want to very quickly mention the nervous system, because I did sort of mention it slightly, and I want to explain to you what I mean by that. Again, kind of going back to, when people have had symptoms for over 3 months, the nerves are involved. This is something that I had started to notice with the clients that I was seeing. I was like, every single person who's had this for this length of time has a nerve problem. And again, when we look into the research, other people have started to see this too. And they've started to research through it. It's called central sensitization. And we get a sensitization of the central nervous system. Now, when we're talking central nervous system, we're talking brain and spinal cord. When we're talking about the nerves that come down the arm, that's a peripheral nervous system. Now, it's all connected, but we get central sensitization. And what the research shows us is this is associated with chronic pain. Chronic pain is basically pain that people have been suffering for 3 months or longer. And what happens at that point is that the body starts to change in response to the pain messages it's been getting. So basically, every time you reach out to pick up your bottle of water, or you hit a shot, you feel your elbow, the messages get sent up to the brain to say pain. And over a prolonged period of time, so over 3 months, we get pain, 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 pain. The brain then kind of goes, okay, I get it. Yeah, we're feeling pain. But what happens is we get biochemical and anatomical changes in the brain in association with those pain messages. So what that leads to is then that pain response is triggered way faster. The slightest little touch is going to trigger a pain response, and it shouldn't. That's the hypersensitivity of the nervous system. What we need to do is we need to calm that down, because the problem that we have is when the nervous system is hypersensitized, it switches into fight or flight response. So the body is basically going, danger, danger, we're feeling pain, this must mean danger, and it flips into survival mode. When the body is trying to deal with survival, it's not going to heal a soft tissue. So it actually slows down the healing process, because it's thinking, do I need to run away? Do I need to fight? What's going on? So your body is flooded with these hormones for fight or flight, and your tissues can't heal. Does that make sense? Have I just like...
No, yeah. It's very interesting. Very interesting. Yeah. No, I like that. Thanks for the explanation. Oof.
Yeah.
Oof, the nerves is very complicated.
Yeah, that's it. So we need to calm those nerves down. Now, there are very simple strategies that we can utilize to do that. And I have listed all of them in my book. So my book is called Tennis Elbow Relief. The second edition is actually coming out. In fact, today it's up for pre-order. Tennis Elbow Relief 2.0. Woohoo! So
nice.
It's on Amazon worldwide. It's for pre-order. And what I've done for Tennis Elbow, for Tennis Summit participants is I've set it at the lowest price that Amazon would let me set it to. And that's going to be for this weekend. So jump on, get your pre-order. Every single strategy to help the nervous system calm down is in the book. So you'll be able to access that.
Perfect. And should I, is that like on the QR, or should I put a different link, or okay?
Yeah,
no,
you definitely can. You definitely can. So I've put some little bonuses together for you guys as well, because you've stayed with me till the end too. So everybody who's on the Tennis Summit right now, you're going to get a free mini course from me. This is Get Over Golfer's Elbow. So you can scan the QR code. That will take you to, I've set up a page on my website that, again, is just for you guys. You can go into that web page, tenniselbowqueen.com/tennis summit. You can click on the link to get the free course. Now, you need to put the code in. Listen carefully. This is the code. Tennis Summit 24. all one word.
Got it.
Tennis Summit 24. You put that in, you're going to get that mini course for free. So the mini course is going to give you the 2 exercises, the stretch and the strengthening exercise that we went through to heal your golfer's elbow. There's also obviously other information in there, it goes into the background, but you guys are going to get that for free. You can also go onto that webpage. You can pre-order the book. When you pre-order the book, email me a screenshot of your pre-order. I'm going to invite you to a live Q&A with me that I'm going to do in May. So if you pre-order the book, you're going to get another live Q&A with me. And if you if you sign up for the All Access Pass for Tennis Summit, there's a link on that page as well. If you sign up through my link, I'm going to send you a physical copy of Tennis Elbow Relief 2.0. So if you sign up through my link, I'm going to send you a physical copy of the new book. Once it is released, you will get that to your door. It's all on that one page. You can check out all of those links, but I love you guys. I love doing this. It's so fun. And I wanted to give you as much as I possibly could. So yeah, what questions do we have?
Awesome. Thank you so much. That's amazing. Let me go to the question. Sorry, I was like looking at the other sheet.
I know you want to sign up, Evan, don't you?
Yeah, I do. That book looks so nice too. I love it. Let's see. Oh, sorry. Okay. When retraining the injured tendon, is the tension on the flexion and extension of the wrist during contact point, is that what needs to be corrected?
Yes, exactly. So the position of the wrist is going to be crucial. So often when we see people with tennis elbow, they most often complain about it with their backhand. However, it can just be gripping. They can be gripping so tight onto the racket with every shot that they generate so much force in the tendon. It's in the muscles. It's pulling on the tendon. And so looking at your grip as well is going to be crucial. Again, this is where a coach comes in. They need to see you doing these things because then they can make those adjustments with you and for you. With golfer's elbow, it most likely is on the serve. We tend to see that, or it could be an outstretched forehand as well, depending on the position that you're in. But again, it all goes down to the biomechanics. Work with an experienced coach who can really help you through that. But you can also bring that muscle tension down yourself by, before playing, you can heat, you can stretch, bringing that muscle tension down. Even during play, you can stretch out. That's going to help bring the muscle tension down and keep everything more comfortable for longer.
Yeah, wonderful. Love it. And then Neil, he actually wrote us, he CC'd me and wrote you, and he had a really nice review. So he says, your process works, not easy, but if you do the work, it works. So love to hear.
Yay. Thanks, Neil.
Yeah.
Nice to see you.
Yeah, awesome stuff. Clark said, I have pain in my arm, shoulder, and it's been 2 years.
Yeah, so definitely central sensitization is a factor there, 100%. And so you need to work with somebody experienced in that. It's, it's a relatively new concept. Central sensitization is relatively new in the research, in the medical research. When things are in medical research, it takes even longer for it to filter down actually into medical practice. So when you find somebody to work with, ask them, how are you going to address my nervous system issues? And if they look at you with kind of like, wait, what? Find somebody else. If they're kind of like, yes, we're going to do this, and this, you found your person.
There you go. Definitely. Another question here. How many times a day does one stretch for the tennis elbow?
Great question. Every time you do the heat. So if you're doing the heat every hour, 10 minutes of every hour, you're gonna stretch after each time you do the heat.
Okay. Nice. Like that. I've got some wrist questions. So does this all also pertain to the wrist, including braces? How about exercises to strengthen the wrist?
Yeah, it definitely does. So the exercises that you do for tennis elbow and golfer's elbow are absolutely going to strengthen the wrist, just because we are going through that full range of motion through the wrist. We're strengthening eccentrically, which definitely helps with that. It really helps with stability around the wrist. Sometimes tennis players do need some rotational elements as well. So you might need eccentric pronation and supination, but you don't start with that. You start with the flexion extension, keep it easy. Again, just do it eccentrically, and then you're not going to irritate any of the tendons. But further through the rehab, you might need some rotational components too, just because of what you guys are doing. Again, because of the biomechanics, we need to make sure that the rotational components that you do when you're playing, you've practiced during rehab, and you've built up strength and stability for that. With regards to wrist braces, that is that wrist brace that we mentioned for nighttime sleeping that does take the tension off it. But sometimes people will like just a sort of like a compression sleeve around the wrist. That can definitely help. It depends whether you've got any issues with the thumb, whether you want to wear one that would incorporate the thumb too. Sometimes people find that can be helpful, but it is very individual.
Got it. Love it. And yeah, I mean, pretty much same answer, I think, for Chris's question about struggling with TFCC wrist injury. So I think that's covered. Let's see what else. Already excellent presentation. We're learning a great deal. Thanks. Love to see that. Thank you. Let's see. Let's say you're doing these things as a preventative measure. Would you still want to prioritize eccentric over concentric in this case? Would strengthening concentric motion help build strength?
Yeah, that's a really good question. I mean, if it's preventative and you don't have any issues with your tendons, you absolutely can do concentric. That's not a problem at all. When I'm rehabbing people, I only focus on the eccentric, obviously for the reasons that we talked about. And people often ask, oh, when do I start doing concentric? Well, the answer is actually you don't need to, because when you're doing your functional activities, when we're getting you back to tennis, when you're starting to do those shadow swings, we start increasing the load, actually functionally increases the concentric strength anyway. Just to go back to when we're doing eccentric loading, when you eccentrically load a muscle, you can actually generate more force within that muscle than a concentric action anyway. So you're actually strengthening it in a better way, in a more efficient way when you're doing the eccentric. And when you are functionally getting back to doing everything you need to do, you kind of get that concentric back. I hope that answers that question.
Yeah, no, totally. And maybe if we can answer this quickly, I guess. John says, don't notice anything when I'm playing, but when I'm sleeping on my dominant side, I get tingling in the hot spot on lateral border of humerus, or both 3 below shoulders is common. Should have mentioned this. Started when I've been playing 4 days weeks a few years ago.
Yeah. So anything when you're feeling tingling, pins and needles, numbness, anything like that, that's nerve. So there's some kind of nerve compression going on when you're sleeping on your side. It could be that maybe you've got one pillow and your head is down here a little bit. That can certainly compress nerves. If you're on one pillow, you definitely need two. We need to fill the gap when we're lying on our sides. We need to fill the gap between ear and shoulder so that we're not compressing down like that. So if that's an issue, definitely try that. It might even be that you just fold a towel and put it under your pillow and just see if that helps to raise it up. But it's most likely coming from the neck.
Got it. Awesome. Well, amazing session. I really had so much fun, and I want to thank you so much, Emma. And please, everybody, scan the QR code or go to the link that I put in the chat, and then use the code Tennis Summit 2024 as well. And definitely take advantage of the All Access Pass from Emma's link through that link in there, because then you'll get a free copy of her physical book, which is looks so good. So yeah, awesome. Emma, thank you so much, and thank everyone for the questions, and hope to connect again soon, Emma.
Yep, you are so welcome. This is always so much fun. If anyone does have questions, please feel free to reach out. Obviously, you've got my website. Please feel free to ping me an email, send me a message. I'm here to help you guys. Thanks, Mivan.
Awesome. Thanks so much. Take care. See you, everyone.
Bye.
Bye.